A very good morning to all of you. Even if St. Augustine had not said this, we all agree that pain is the greatest evil on earth. And our patients say, I would do anything to relieve the pain. I would like to divide my talk into 4 parts. Even though my talk is on alternative therapies, I have to mention a little bit about conventional therapies, the options there, pros and cons of that, and then I come to alternative therapies, why and which, and finally, what does the evidence say about the alternative therapies. The standard of care in our care, that conventional therapy has been surgery plus medicine. Now, surgery especially is the foundation of treatment for women with moderate to severe endometriosis, especially those with adhesions, and when this disease involves non-reproductive organs. The conservative surgeries, we had a beautiful video presentation yesterday of different types of surgeries done: removal of or destruction of implants, removal of endometriomas, lysis of adhesions, and appendectomy, not appendicectomy. The definitive surgery involves TAH, BSO, and removal of all visible endometriosis. The surgery for midline pain involves presacral neurectomy, resection of the uterosacral ligaments, and the famous LUNA. But we must remember, they do not diminish pain in other areas of the pelvis. This particular thing, I have no experience. It is actually in the experimental stages. There's an intravenous injection of a special dye that is concentrated in areas of endometriomas, and then a laser light produces photochemical reaction to destroy the areas. As I said, it's undergoing preliminary trials. The medical management actually is aimed at suppression of lesions and associated symptoms, particularly pain, best achieved by menstrual suppression, ideally without inducing hypoestrogenism. The choice of medical therapy, of course, should be individualized, weighing the potential adverse side effects and cost and compliance of the patient. It mainly involves either a pseudo-pregnancy regime, which involves progesterone or continuous OC pills, or pseudo-menopausal regime, which involves GnRH or danazol. Non-hormonal agents also are used for relief of pain, like NSAIDs. They are not only beneficial in relieving the pain, as a concomitant therapy, they may improve the bleeding control of patients on oral contraceptives. Pentoxifylline has shown some promise. Then there are a whole lot of off-label drugs that are used in endometriosis. Aromatase inhibitors like letrozole, though it's not available in the market now for this use also. SERMs, especially tamoxifen and raloxifene. Antiprogesterones like mifepristone, and recently we are hearing lots from the representatives that antiprolactins like cabergoline, which is used twice weekly for 6 weeks, 6 to 10 weeks. Let's see the pros and cons of conventional therapy first. The surgical treatment, of course, this review has shown the pain decreased by 62% compared with 22.6% with expectant management alone. Pain relief continued in 55% of women over 72 months, but promptly it comes back, and an average estimated time is 20 months. The problems with surgery are recurrence, and when there is recurrence, repeated surgery. Repeated surgeries become difficult surgeries, and there will be a lot of complications thereafter, and you require a lot of expertise then, and the cost will eventually escalate. This review, online review, has clearly shown that the combining laparoscopic removal of deposits with uterine nerve ablation reduces the pain and improves the quality of life, but it is complicated by adhesions and damage to pelvic structures. Hormonal treatment may reduce pain and other symptoms when given for 6 months after conservative surgery. The medical management, the problems with medical management is that there's recurrence rate of 5 to 15% in the first year, and it increases up to 40 to 50% in 5 years. The problems with medicine are the failure to respond in the first place, or poor response if at all, and then if the response is there, it is temporary. As a result, you can't use the drugs for long. If you use it for long, then there will be undesirable side effects, and of course patient non-compliance, and that leads us to more off-label drugs. If you go to the net, you will see thousands of off-label drugs that are used for endometriosis pain. Again, the same review has shown that hormonal treatment reduces pain when given at diagnosis itself. In that, efficacy of dydrogesterone given at diagnosis is doubtful. OCPs are less effective, but compared to GnRH, they are less likely to have the reduced bone mineral density and other side effects. Adverse effects are common, particularly with danazol, gastrinone, and GnRH analogs. Effective in eradicating symptoms producing complete regression or recurrent when you give norethindrone for a long-term therapy, considered for patients who are likely to adhere to a prolonged treatment. Cochrane review says medroxyprogesterone is more effective compared to dydrogesterone, and then there's no evidence of a benefit with depoprogesterones versus other treatments like oral contraceptives and leuprolide acetate. In fact, depoprogesterones are experienced with significantly increased adverse side effects. There's no evidence of a benefit with gastrinone compared to danazol. GnRH analogs are found to be significantly improve the dysmenorrhea than gastrinone, but they have got a lot of side effects and like postmenopausal symptoms. In conclusion, limited evidence to support use of progestrogens or antiprogesterones for pain associated with endometriosis, and more side effects with GnRH analog, hence limiting the long-term use. So naturally, we had to look for the off-label drugs, and the evidence as far as off-label drugs, something like 104 papers over 11 years suggested difficult to judge whether mifepristone is truly efficacious. Another study on letrozole showed that letrozole reduces the intensity of pain, and combining it with norethisterone was associated with lower incidence of adverse effects and lower discontinuation. LNG IUS also has been tried. It is clinically efficacious, equivalent to that of GnRH analog, and the advantages, it can be put there for a 5-year time. It may have some clinical advantages over GnRH analogs. Pentoxifylline, 4 trials have shown it is still not enough evidence to support the use of pentoxifylline as for the pain relief. As far as gabapentin and amitriptyline, it is better than amitriptyline alone. Long series of treatment with interferon is more effective than the short series interferon. So now I come to my topic proper, that is alternative therapies, why and which. What is alternative or complementary therapies? It's a group of diverse therapeutic or preventive healthcare systems or practices and products that are not presently considered to be part of conventional medicine, and the best part is they may not have a scientific explanation for their effectiveness. Complementary therapy is something which you use together with conventional therapy, and something like aromatherapy along with other drugs or surgery, and alternative medicine is instead of or in place of conventional medicine, something like special diet that can be given instead of chemotherapy. Integrative medicine is the one which combines mainstream medical therapies and CAM therapies for which there is some high quality scientific evidence of safety and effectiveness. Now let's look at what are the options that we have. Whenever we talk about alternative medicine, the alphabet of that alternative medicine starts always with A for Ayurveda, and somebody asked me what is Z stands for. Z stands for maybe Zandubam. Okay, so Ayurveda has been extensively used for all sorts of pain relief, also in endometriosis. But it's yoga, especially Supta Buddha Konasana, is the one which is recommended whether you do it in lying down position or sitting position, which is supposed to help endometriotic pain. Of course, this dance therapy also has been suggested by some. I think it's very difficult for the patients to do this pose. Meditation. When I was going through this with a friend of mine, the review of this particular presentation, he said, you ask your patients to meditate away from you so that they cannot contact you if there is pain relapse. Natural therapy seems to be the therapy for most of our ailments, so also the pain in endometriosis. They advise reduce the chemical intakes, increase vegetable intakes, and then of course omega-3 fatty acids it's like treatment for all now. And it reduce the stress by using vitamin B, C, zinc, magnesium, etc. And then hydrotherapy, sitz bath, hot water, cold water cycle is repeated 3 times a day. We know it relieves pain, especially in episiotomy and things like that. So similarly, extension of that may be useful, especially patients are having rectovaginal endometriosis. Ginger tea. Now, tea is now becoming a panacea for everything, especially the green tea taken in green cup. Homeopathy. Somehow, patients, when they come to us, they want relief the next day. Whereas in homeopathy and other situations, other medicines, they don't mind taking years together. So probably the verbal therapy acts more than the actual therapy there. I don't know. Reiki is another wonderful treatment. I really wish I had such arms which you just sway over the patient and the pain goes off, right? And then you have Chinese herbal medicine, extensive. The best part of their medicine is that they have done extensive studies, they have done randomized control trials, and they have subjected themselves to the Cochrane review. I'm going to shortly talk about them as well. And then we have herbal therapy, which is basically like anti-estrogens. The effective herbs are so many. I personally, maybe I like peppermint if I had endometriosis. And then options of other Chinese medicine like acupuncture. I always thought acupuncture is so painful itself. How does it relieve pain? But when I go to the net and look for the pictures, somehow the ladies are very peaceful and they are happy. At least they are smiling. And then the acupressure, if not acupuncture, acupressure, again you do it with different gadgets. Here also patient is looking not really stressed. And then cupping, this really looks very ghastly. I know you put the hot air in that cups and the blebs are looking so painful. But again, as far as the picture is concerned, she's peaceful, happy in the picture. And then the stone therapy, probably the easiest of all. Actually, if you go to the riverside, pick up some stones and then keep it handy. And then chiropractic, very popular in America. It is also used not only for orthopedic ailments, it's also used for endometriotic massage. I don't have to talk more about this in Kerala. So massage is now relieving pain of all sorts of problems, especially endometriosis. I mean, these things are becoming popular because we really have, as I told you in the beginning of my talk, we have a very limited medicines or surgeries to offer. Aromatherapy, who doesn't like aromatherapy? So here again, it is so beneficial even if you are taking other medicines along with. Aromatherapy has got again antiviral and fungal bacterial properties. There are so many types of oils that are useful in aromatherapy. Exercise is really helpful in relieving or at least diverting your pain, and we all know that the exercise will stimulate the release of endorphins. In fact, a very interesting and wonderful study done where two groups of patients, one group was given the drug and told that you are not getting the drug. The other group was given the same drug, the painkillers obviously. Surprisingly, the patients who were told you are not given painkillers but just the placebo, they had pain relief. That means something to do with endorphins that are released inside our body. It's demonstrated stress reliever, pain reducer, and antidepressant fighter and depression fighter. Tai Chi has become very popular in America. A friend of mine was telling they are offering now Tai Chi for endometriotic ladies. So it's a very simple kind of exercise. When you see them, you feel that they are just lazing around, they're not doing anything in the garden, but they're actually doing Tai Chi. And then of course, a whole lot of things about diets. Low glycemic diet is supposed to be beneficial, and dairy products, an extensive study has been done. I'm going to show that very soon. They have got immunomodulatory effect and in fact, we now know that endometriosis is something like an inflammatory disease. They have got immune factors which are altered in women with endometriosis. And then I read somewhere you have to eat every day 5 color type of fruits. And I found luckily one fruit which has got all the 5 colors, right? And then whole lot of textbooks or books on diet for endometriosis. There are plenty of them on the net. TENS therapy was very popular once upon a time when I was PG, especially for chronic pelvic pains. It is making a big comeback for endometriotic pain. The final leg of my talk is about the evidence on alternative medicines. They are not just there as therapies, alternatives, but there is some amount of work or the trials have been done on this. The evidence on CAM therapies, while some scientific evidence exists regarding some CAM therapies, for most there are still key questions which has to be answered by the bigger trials. The alternative therapy Ayurveda, homeotherapy, dietary considerations, and herbal therapies can be used as supplementary treatment. Many women experience an additional usefulness when they use these kind of therapies. Acupuncture appears to be an effective and safe and well-tolerated adjunct therapy for endometriosis, but this has to be confirmed in further study. I told you even Cochrane has reviewed some of these trials, and it has found that there is some evidence to support the effectiveness of acupuncture for pain therapy in endometriosis. Chinese herbal medicines for endometriosis, I told you, again Cochrane review has been done. 2 Chinese RCTs involving 158 women. Comparable benefits to gestrinone, but fewer side effects have been seen compared to the GnRH and gestrinone. Better overall treatment effect than danazol. Another Chinese herbal medicine therapy, 320 patients randomized in 2 groups of Chinese herbal medicine or GnRH analogs post-operatively. They found that Chinese herbal medicine is more effective than GnRHA in improving post-operative quality of pain. PMR, that is progressive muscular relaxation training, is effective in improving anxiety, depression, and quality of life of endometriosis patients under GnRH analog therapy. So this is in combination with GnRH. And as far as the physical therapy or physiotherapy is concerned, intervention is effective in reducing the perceived stress, normalizing cortisol levels, increasing vitality, and improving physical functioning. As far as dairy products, I told you, our largest study, which is called Women Nurses Health Study, involving 70,556 women, higher intake of dairy foods are associated with a decreased risk of endometriotic pain. So, is it time to redefine the standard of care, that is surgery plus medicine? Yes, I would like to redefine it as triad of treatment, which involves basically surgery to remove all the possible endometriotic tissues or the nodules or the cysts or the adhesions, and maybe followed up with medicine, and then side by side you can think of alternative medicine. Probably the better thing would be integrated therapy. The integrated therapy may involve something like this. First, surgery plus allopathic medicines. If that doesn't work, or side by side Ayurveda, homeopathy, naturopathy. The truth is, patients are clandestinely taking Ayurvedic medicine along with our medicines all the time, whether it is infertility, whether it is pain, or whether any problem in them. So then, of course, you can advise yoga, meditation, aroma. It doesn't take much of your the time. Chinese herbs, low glycemic diet, and dairy products can be made like a lifestyle. And if those things do not work, you can try Tai Chi, acupuncture, or exercise. And when that doesn't work, again come back to surgery, allopathic medicine, and keep cycling them throughout your life till you attain menopause. And when you attain menopause, hopefully, there is relief from endometriosis. So the sum and substance of what I said in last 20 minutes is that the hormonal treatments can reduce pain when diagnosed, but there is a limitation for that. And as far as the hormones are concerned, OCPs are less effective, but they are the ones which can be used for a on the long-term basis. GnRH is definitely better, but you must know that they have got more side effects, especially the postmenopausal type of side effects, and their use is limited in terms of 3 to 4 months or 5 months maximum. And efficacy of off-label allopathic drugs are doubtful. However, you can try them when other drugs are not working. And as far as surgery is concerned, laparoscopic removal and nerve ablation reduces the pain, but has its own complications, the recurrence especially. And alternative medical therapies have been found to be useful as good adjuncts, not as the first-line therapies. And integrative medicine seems to be a better approach. So finally, I would like to end my talk using his words that pain is inevitable, but suffering is optional. So we have to try really, along with the patient, what suits her the best. So thank you for your kind attention and patient listening.